There is a forgotten Korean morning tea that drains swollen ankles and restores lymph flow in 2 weeks, and your doctor has never mentioned it. I want you to do something right now. Take off one sock. Look at where the elastic's at. If you can see a groove in your skin, an indentation that takes more than 30 seconds to smooth back out, keep watching. Because that groove is telling you something your last cardiology appointment probably missed. Her name is Soon Hee. She is 69 years old. For 2 years, her ankles swelled every evening tight, heavy, leaving deep sock marks by bedtime. Her cardiologist told her heart was fine. The diuretics she was prescribed ran her to the bathroom all night without fixing the ankles. And a few years before that, her American doctor had told her to cut back on fermented foods after a borderline reading on her sodium panel, so she stopped drinking Boricha. The roasted barley tea her mother made every morning in Incheon, and stopped eating doenjang soup. When we finally reviewed her chart together, there was no heart failure, no kidney disease, no actual contraindication for those foods. She had stopped her mother's morning routine for nothing. That is what today is about. Don't look at your heart. Look at your lymphatic vessels. Your doctor probably told you the swelling is your heart, or your salt. In roughly 70% of people over 60 who show up with puffy ankles by evening, it is neither. It is a drainage problem, and there is something Korean households have quietly used for generations to address the root cause, something that has never appeared in a single Western treatment guideline. Here is what no one is telling you. By the time you notice sock marks every evening, your lymphatic vessel walls have likely been stiffening for years. Not because of a disease, because of something quieter, a slow decline in the anti-inflammatory foods you eat every day, and a slow rise in background inflammation that your body cannot fully clear. The vessel walls stiffen. The smooth muscle inside them loses pumping tone. Fluid that should be cleared overnight accumulates instead. By morning, the groove is still there. And here is the part that matters most. If you get to the end of this video and do nothing, that process continues. The vessel walls become less pliable, the pumping becomes less efficient, and the swelling starts earlier in the day, not later. By the end of this video, you will know exactly why your lymphatic vessels stiffen after 60 at the biochemical level, the explanation most people never hear. Which 3 components of the traditional Korean morning food matrix address that root cause directly? The exact daily protocol with doses, preparation, and timing. The 4 mistakes that make this worse even when people are trying to do everything right. And who needs to talk to their doctor before starting? Because knowing the boundaries is what separates credible information from hype. Most people will never hear this from their doctor, not because your doctor is withholding it, but because these compounds cannot be patented. When researchers began publishing data on roasted barley beta-glucan and fermented soybean magnesium, there was no mechanism for a pharmaceutical company to own that research, no incentive to fund large-scale trials, and so it never entered Western treatment guidelines. Without guidelines, doctors don't recommend it, and a morning routine that Korean women have maintained for centuries gets dismissed as tradition until the peer-reviewed data starts accumulating and becomes impossible to ignore. If you close this video right now, you will keep doing exercises that move fluid that has already accumulated without addressing why it accumulates in the first place. Stay with me. Here is what most people don't know. Your body has 2 completely separate drainage systems. Everyone knows about the blood vessels, but running alongside them is a second network, the lymphatic system made up of thin-walled vessels that collect the excess fluid your blood vessels leak into surrounding tissue and carry it back to your heart. This system has no dedicated pump, no heart-pushing fluid through it. It moves entirely by the rhythmic squeeze of smooth muscle built into the vessel walls themselves. When those walls stiffen and that muscle loses tone, the fluid simply sits. And unlike your cardiovascular system, no standard test at your annual physical checks whether this second system is working. You find out when your sock leaves a groove. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and mourning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was the same cluster of habits. And one of the most consistent ones, something I had never been taught in medical school, was a morning food routine, centered on a compound found in roasted barley that researchers have now studied in human clinical trials. The more I dug into the data on Korean fermented foods and lymphatic function, the more I understood why my Korean patients, mothers, and grandmothers who maintained this routine every day of their lives almost never came in with the ankle swelling I was seeing in their American-raised children. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you the exact Korean morning food matrix and why it works on lymphatic vessel walls at the cellular level. Not just what it does, but why the specific biological mechanisms, 4 of them, that explain why vessel walls stiffen after 60, and how the Korean morning routine addresses each one directly. The research behind each compound institutions, participant counts, durations, and measurable results so you can verify every claim yourself. A complete daily protocol, morning, midday, and evening, with exact preparation, timing, and what to combine with what. The 4 mistakes that destroy the effectiveness of this protocol, even when people think they are doing it right. The medication interactions and medical situations where you need your doctor's input first, including 1 hard contraindication. You must know if you are on heart medication, and who should consult their physician before starting, because that boundary is exactly what makes this information trustworthy. Before I give you the protocol, I need to explain something your doctor has probably never walked you through. Why lymphatic vessels stiffen after 60 in the first place. Because if you understand the mechanism, the protocol makes complete sense. And if you skip this section, you will probably skip the protocol too. Mechanism 1. The inflammatory stiffening of vessel walls. Think of your lymphatic vessels like a garden hose made of living tissue. When the wall stiffens from years of low-grade chemical irritation, the hose loses its give and fluid backs up. After 60, daily intake of anti-inflammatory compounds quietly declines while background inflammation rises, what researchers call chronic low-grade systemic inflammation. This inflammation attacks the lining of lymphatic vessel walls and progressively stiffens them. The Korean compound that addresses this is rosmarinic acid, found in Korean perilla leaf, kakkaenip jagaisep. Rosmarinic acid is a documented anti-inflammatory polyphenol that reduces 2 specific chemical messengers, i.e. L6 and TNF-alpha, that circulate through lymphatic channels and drive vessel wall stiffening when chronically elevated. This is the upstream intervention that physical exercises alone cannot provide. Mechanism 2, the smooth muscle. Pumping deficit. Think of your lymphatic vessels as a conveyor belt, with a motor built into the belt itself. The motor is the smooth muscle layer in the vessel wall. When it loses tone, the belt slows. The direct driver of smooth muscle contraction is magnesium. When intake is insufficient, increasingly common after 60, as dietary variety narrows, the motor weakens and fluid accumulates. The Korean source that restores this is dietary magnesium from traditional doenjang, doenjang, Korean fermented soybean paste. A review from Dongguk University confirmed doenjang's role in gut microbiota and immune modulation, and fermented soybeans are a direct dietary source of magnesium. 1 bowl of doenjang jjigae a day provides meaningful magnesium for the smooth muscle tone that moves lymph fluid through the vessel network. Mechanism 3. The inflammatory burden reduction. Think of your lymphatic system as a municipal drainage canal. If upstream flow exceeds capacity, the canal floods regardless of how well maintained it is. The fix is to reduce the upstream flow. When systemic inflammatory burden is high, lymph vessel walls stiffen, capillaries leak more fluid, and the lymphatic system faces higher volume with reduced pumping capacity. The result is swelling. Boricha roasted barley tea, Boricha, Boricha, addresses this through beta-glucan, a soluble fiber that reduces systemic inflammatory burden. A human clinical trial at the University of Ljubljana followed 43 volunteers for 4 weeks. Beta-glucan reduced total plasma cholesterol, confirmed by the data to be a real effect, and increased a short-chain fatty acid called propionic acid by 43.2%. Less systemic inflammation means more pliable vessel walls and a lower fluid load to clear. Boricha is also caffeine-free. Caffeine is a mild fluid loss driver that can thicken lymph fluid. Boricha gives you hydration and anti-inflammatory beta-glucan in the same cup. Mechanism 4. Capillary permeability reduction. Think of your blood capillaries as the pipes in a building. Normally, they are tight. When chronic inflammation damages the pipe lining, fluid seeps through the walls into surrounding tissue, and your lymphatic system has to drain it. After 60 years of low-grade inflammation, progressively loosen the tight junctions between capillary wall cells. The combined anti-inflammatory effect of rosmarinic acid from KKNIP and beta-glucan from Boricha reduces capillary permeability. Less fluid leaks into surrounding tissue in the first place. The lymphatic system has a smaller backlog to clear every hour because the source has been reduced upstream. Exercises move fluid that has already accumulated. This protocol reduces how much accumulates by addressing inflammation upstream. The exercises address the symptom. This protocol addresses the cause. Here's the exact daily routine. I will tell you what to take, how to prepare it, when and what not to do. And at the end, I will tell you explicitly what is taken together and what is taken at different times. Before your feet hit the floor. Morning ankle pumps. Before you stand up, while still lying in bed. 30 ankle pumps. Point your toes down toward the foot of the bed, then flex them back up toward your face. 30 times. It takes 45 seconds. This activates the calf muscle pump while your legs are still horizontal, moving overnight accumulated fluid before gravity pulls it back into your ankles. This is the mechanical complement to everything the T protocol does upstream. Do not skip it. First thing after rising. Boricha, Boricha. Warm roasted barley tea, your morning anti-inflammatory and hydration anchor. 2 tablespoons of roasted barley grain simmered in 500 milliliters of water for 20 minutes, or 1 tea bag steeped 10 minutes at 175 degrees Fahrenheit, 80 degrees Celsius. Drink immediately after rising. Source at Korean grocery stores, H Mart, or any Asian supermarket. Look for Boricha or roasted barley tea. Barley only, no additives. Boricha contains gluten. Confirmed celiac patients should avoid it. Do not replace this with coffee. Caffeine drives fluid loss and thickens lymph. Midday meal, KKNIP, Gaesip, Korean perilla leaf. At lunch or dinner, 4 to 6 fresh perilla leaves KKNIP wrapped around rice and bean paste, or added as a leafy side. This is your rosmarinic acid delivery. Korean grocery stores and H Mart carry fresh KNIP year-round. If fresh isn't available, dried perilla leaf as seasoning 1 teaspoon over a meal works. Do not substitute Italian basil. Different species, different active compounds. Take with your largest meal alongside fat, fish, tofu, sesame oil. Fat increases absorption of these polyphenols. Once daily doenjang soup, doenjang jjigae. 1 small bowl of traditional doenjang jjigae, your magnesium source for lymph vessel. Smooth muscle tone. Use traditionally fermented doenjang 3 to 6 month minimum aging on the label. Quick fermentation commercial products have a different microbial profile and your body absorbs less of the magnesium. Available at Korean grocery stores and H-Mart. Sodium. Doenjang is naturally high in sodium. If you're on strict sodium restriction, heart failure, kidney disease, use a smaller portion, 1 to 2 tablespoons paste in broth. Thyroid medication. Soy isoflavones can slow levothyroxine absorption, separate doenjang from thyroid medication by at least 4 hours. Estrogen-sensitive cancer. Consult your oncologist before increasing soy intake beyond culinary amounts. Evening Boricha. Again, legs up the wall, manual drainage. 90 minutes before bed, 15 minutes lying on your back with both legs up the wall at 90 degrees. A folded blanket under the hips helps. Slow ankle circles in that position, 30 rotations each direction. 3 minutes of slow, deep belly breathing your thoracic duct, the main trunk returning lymph to your bloodstream, is activated by diaphragm movement. 10 slow upward strokes on each calf, palm flat, ankle to knee, light pressure only. Evening drink. A second cup of Boricha. Alcohol dilates capillaries and increases their permeability, the opposite of what this protocol needs. Boricha closes the day the same way it opened it. During the day, hourly calf pumps. Every hour of sitting, 20 calf pumps. Heels on the floor, pump the toes up and down. This keeps the calf muscle pump, the most powerful lymphatic assist in the lower body, active throughout the day. If knee pain or limited mobility prevents this, substitute 30 seated ankle circles in each direction. The ankle motion activates the same lower leg pump through a different joint. What is taken together and what is taken separately. Boricha, morning. And the ankle pumps are paired pumps first. Tea immediately after. Kakayanip is taken with your midday or evening meal alongside fat-containing food. Doenjang soup is once daily at any meal, but if you take levothyroxine, separate doenjang from that medication by at least 4 hours. The evening Boricha, legs up protocol, and manual drainage sequence are all part of the same 90-minute wind-down block. Do not combine Boricha with coffee in the same 30-minute window in the morning caffeine. Counteracts the hydration benefit. Tracking 2 numbers to ask your doctor for at your next appointment. Ask for a high-sensitivity CRP that is a blood test, measuring the level of systemic inflammation in your body, and a serum albumin, which measures protein levels. Low albumin is a silent driver of tissue swelling that has nothing to do with the lymphatic system. It means fluid is leaking from blood vessels because there is not enough protein to hold it in. If your albumin is low, that is a separate conversation with your doctor about protein intake. High CRP above 3.0 milligrams per liter confirms the inflammatory burden this protocol directly addresses. Retest yourself with the sock groove and the stemmer sign at 2 weeks. The stemmer sign. Pinch the skin on the top of your second toe at the base. If you can lift a fold of skin easily, that is normal. If the skin feels thick and cannot be lifted into a fold, that is the stemmer sign, a clinical indicator of lymphatic swelling in that limb. It warrants a physician evaluation. Contraindications read these. One-sided ankle swelling warrants physician evaluation burst. It can indicate a blood clot or structural lymph node damage. Digoxin or any cardiac glycoside. Do not add Korean hawthorn tea, sansacha, without cardiologist clearance. Hard contraindication. Warfarin. Kimchi contains vitamin K. Daily intake is generally manageable. Monitor your INR when first introducing regular kimchi. Insulin, metformin, or sulfonylureas. Doenjang's mild glucose modulating effect may be additive. Monitor your fasting glucose during the first 4 weeks. Prednisone or another corticosteroid. The steroid increases capillary permeability, the opposite of what this protocol does. The protocol may help alongside corticosteroid treatment, but does not replace any tapering plan. A note on rebounders and vibration plates. Several people ask about rebounders and vibration plates for lymphatic drainage. The answer is yes. Rebounding creates rhythmic compression of lymphatic vessels that closely mimics the calf muscle pump. It is an excellent complement to this protocol. If you have access to a rebounder or vibration plate and your joints tolerate it, use it. 10 minutes of gentle bouncing in the morning or evening works alongside the T protocol, not instead of it. Secondary note: Korean hawthorn, Sansa chai, for venous component swelling. If your swelling follows a venous pattern worse after standing, better after elevation, accompanied by visible surface veins, Korean hawthorn tea, Sansacha, Sansaka, may offer additional support through its documented cardiovascular and endothelial effects. A review of over 4,000 patients and a smaller flow-mediated dilation study in 21 patients found hawthorn extract supports vascular wall function. Sansacha is not part of the lymphatic protocol. Above it is a separate cardiovascular support tea. And if you are on digoxin or any cardiac glycoside, do not use Sansacha without cardiologist clearance. Full stop. That interaction is serious. Mistake 1. Doing the exercises without addressing inflammation upstream. This is the most common pattern I see. People faithfully do the ankle pumps, the legs up the wall, and the calf raises, and they see modest improvement, but the swelling returns every evening. Exercises move fluid that has already accumulated. They do not address why vessel walls are stiff or why capillaries are leaking. The fix: treat the exercise protocol and the morning food matrix as a single protocol. You need both. Mistake 2. Stopping doenjang and Boricha because of a sodium panel reading without an actual heart failure or kidney disease diagnosis. This is Soonhee's mistake, and it is far more common than most people realize. A borderline sodium reading or a general watch your salt instruction leads people to drop their entire Korean fermented food routine. But that instruction is typically aimed at processed food sodium, industrial salt-preserved packaged products. Traditional doenjang and Boricha are not in that category. Dropping them removes the magnesium, the beta-glucan, and the anti-inflammatory compounds that were actively supporting lymph vessel tone. The fix: with no active heart failure or kidney disease diagnosis, discuss restoring the traditional morning routine with your doctor before eliminating it entirely. Mistake 3. Using commercial quick fermentation doenjang instead of traditionally fermented doenjang. Quick fermentation doenjang, widely available in large commercial tubs, is produced in days using industrial starter cultures. Traditional doenjang ferments 3 to 6 months minimum, developing a different microbial community and nutrient profile. The magnesium and isoflavones that support smooth muscle contractility are associated with the traditional process. The fix: look for a fermentation duration on the label: 3 months, 6 months, or longer. Mistake 4. Expecting results in 3 days and stopping before 2 weeks. This protocol works by gradually reducing the systemic inflammatory burden that has been accumulating, in most cases, for years. Vessel wall pliability does not restore in 72 hours. The reasonable expectation for first measurable change, sock groove gone by lunchtime, instead of lasting until morning, is 2 weeks of consistent daily intake. The fix: commit to 14 days before evaluating. The systems we have been talking about today exist in you right now. Your lymphatic vessels still have smooth muscle in their walls. Your capillaries still respond to anti-inflammatory signals. Your thoracic duct still activates with deep breathing. These are not systems you have lost. They are systems that have been under-supported. The question is not whether your body can do this. It can. The question is whether you are giving it what it needs: the magnesium for the smooth muscle, the rosmarinic acid for the vessel wall inflammation, the beta-glucan for the systemic inflammatory burden consistently, every morning in a form your body can actually use. 1 warm cup of Boricha in the morning, 30 ankle pumps before your feet touch the floor, a bowl of doenjang soup once a day. 4 to 6 perilla leaves with a meal. That is the complete starting point. 4 mechanisms addressed simultaneously: systemic inflammation reduced, vessel wall pliability restored, smooth muscle tone supported, capillary leak rate lowered. The exercises move fluid already accumulated. The food matrix reduces how much accumulates. Soon he followed this protocol for 2 weeks. The sock marks that had lasted until morning were gone by lunchtime. By 4 weeks, her high-sensitivity CRP, her systemic inflammation marker, had dropped from 3.6 milligrams per liter to 1.4. She was sleeping through the night without the diuretics that had been waking her for 2 years. She looked at me and said, "I stopped my mother's morning food routine because an American doctor said so. My mother never had swollen ankles in her life." The research now explains why her mother was right. If this was useful to you, share it with someone who needs it: a friend, a sibling, a parent who has been living with sock marks every evening and been told it is just aging. It is not just aging. It is something that can be addressed. And if you want to see the research behind what I cover here, subscribing means you will not miss the next video when it posts. Next week, I am covering a compound that does something even more targeted. It does not just reduce systemic inflammation. It works directly on the cells lining your blood vessel walls, restoring their ability to produce a molecule your cardiovascular system cannot function without. Researchers identified the compound decades ago in a traditional Korean fermentation process. It has been in Korean kitchens the entire time,